Alright, so to start this off, we go over BSI and scene safety. And the scene is safe. The nature of illness, the patient isn't feeling too well with no obvious signs of distress and no breathing difficulty. Number of patients, it's just one patient. We will request additional resources and we could cancel if needed. We will consider the C-spine as well. For general impression, it's a 32-year-old male, and the position that he is in a seated position. So I believe a Fowler position. He seems alert and awake because he is responding to the police officers that are on the scene. So the chief complaint. So while I'm here, the patient isn't feeling too well, and there doesn't seem to be any life-threatening injuries. And now we will go over the ABCs. And first, we'll go over C, which is circulation. There is a rapid but regular pulse, strong carotid pulse, pelvical diaphoretic, which could mean that the patient is in shock. There's no bleeding, so that's always a plus. No life-threatening bleeding injury. For the airway, it is patent, so it's open. For breathing, it's adequate. It's also, there's 20 respirations per minute, which is normal and perfect. The SpO2 is 97% saturated, which is good. It's a little on the higher side, I believe. Lung sounds are clear bilaterally, which is also really good. Now we'll go over OP, QRST, and sample. For O, for onset, it was sudden, so it happened rapidly. For P, which is provocation, patient isn't responding appropriately. So nothing seems to make it better or worse. For Q, for quality, he doesn't describe it, or he can't describe it, the quality of pain. For radiation, which is R, he doesn't feel pain, he doesn't feel well, so it doesn't radiate anywhere because he can't really explain it. For T, which is time, approximately 30 minutes ago is when this situation happened. And now we'll go over sample. We just went over P, Q, R, S, T. We just didn't go over S, severity. For sample, for S, altered mental status. For signs and symptoms. For the A, allergies, there's no allergies. For M, which is medication, he takes insulin, so that helps with his blood glucose levels. For P, which is past medical history, diabetic type 1. For L, last oral intake, breakfast 5 hours ago. So he could be low on his blood sugar levels. For E, for events leading up to the illness, he was heading on a campus trip with family, been on the road for 4 hours. We'll go over to the vitals. For blood pressure, it's 50 mg over DL. For respiratory rate, it's 120, which is normal. For blood pressure, it is 152 over 97, which seems to be a little high. For respiratory rate, as we said earlier, it's 20, which is normal. For the eyes, we would do Pearl, and Pearl stands for people's. Let me see. I believe people's people's something are reactive to light. Pupils equal are reactive to light. Pulse ox is 97%, as we said earlier. So what we would do with this patient is a load and go, and then we'll continually assess his vitals as we make our way to the hospital, and we will give him supplemental oxygen through a non-rebreather mask at 15 liters per minute.